So good morning, all attendees. Good morning to all of you. Today, we welcome our proud alumni, Ms. Kaveri Dang, to give a guest lecture, and I invite Dr. Swati Tripathi to introduce Ms. Kaveri Dang to all the audience.
Thank you, sir. We welcome you all to this alumni lecture. Let me introduce Ms. Kaveri Dang to all of you, to the audience present here. Ms. Kaveri is currently working as Food Safety and Quality Supervisor at SFC Global Supply Chain, Sean's at Kansas, USA, since last year. Her responsibilities include developing SOPs across FSQ, operations, maintenance, and supply chain to improve plant quality systems. She is also involved with executive preventive controls on need basis, enduring compliance with USDA regulatory standards. She graduated with MS Food Science from University of Central Oklahoma in May 2024. At UCO, she is working as research assistant at Department of Biology, Riley. Her research focused on elucidating role of bacteriophages in meat and dairy products. Kaveri graduated from Amity University in May 2018 and has been involved in microbiology and food safety research since then. We welcome you, Kaveri.
Hello, everyone. Am I audible to you?
Yeah, you're perfectly audible.
All right. Well, hello, good morning, everyone. Um, Before I start with my guest lecture, I just want to thank Dr. Amit Kharakwal, who gave me this amazing, incredible opportunity to reconnect with my alma mater. And it has been it's a great honor to deliver this lecture. I am elated to have this opportunity. So, if I have the permission, I can start with my topic.
Please start, Kaveri. Please start.
All right, I'll just share my screen. Is the screen visible?
Yes, it is visible. It is visible.
All right. Okay. So today I will be talking on food safety, ISO, and HACCP. Uh, Before I get into what food safety is and why this topic is really necessary, even more so nowadays, I just want to present some key facts with you. So, food safety, nutrition, and food security, they are inextricably linked. An estimated 600 million, which is almost 1 to 10 people in the world, they fall ill after eating contaminated food, and 420,000 die every year. It's approximated at $110 billion that's lost each year in productivity and the medical expenses resulting from unsafe food in low and middle income countries. Children under 5 years of age, they carry about 40% of the foodborne disease burden with about 125,000 deaths every year. And foodborne diseases, they also impede socioeconomic development because the more diseases prevalent, the more strain it would put on healthcare systems. And that harms the overall national economies, tourism, and trade. So, food safety is not just a responsibility for people associated with food industries or people working with food science, food industries. It's everybody's responsibility among different national authorities, and it requires a multi-sectoral One Health approach. So let's start with what exactly is food safety? Why is it so prevalent topic nowadays? So it refers to the conditions and practices that preserve the quality of food to prevent contamination and potentially severe health hazards. Basically, what food safety is, it is a scientific discipline and it describes handling, preparation, storage, and serving of food in ways that prevent foodborne illnesses. And it also includes routines and practices that should be followed to avoid these issues. So food safety, when I say what food safety is, it means we are working towards reducing any or all sorts of contamination to make sure that our food that is right from the farm level up to the consumer level, that's 100% safe to consume. But when that does not happen, it means that there is contamination of food. But this contamination can happen at any step in the food chain, and starting from primary production to raw material transport, the storage of these raw materials, processing of food, or production of food in manufacturing facilities, the way you handle the food, the way it's packaged, under what circumstances, the finished product storage, their distribution from the warehouse till the distributors, till the end consumers, they are who are farmers. I'm sorry, consumers. So it literally starts from the primary production and goes until end users or end consumers. And there are so many possible events that can result in food contamination and leading to severe illnesses, hospitalizations, and even death. So these are the broadly classified causes of food contamination. The first one is biological, second one is chemical, and the third one is physical. So when these causes contaminate any food product by their biological agents or with from the toxins or any substance or an object, so that is called as food contamination. Now, these agents, the way we define these contaminants as they're not inherently present in the food, but due to some issues or due to some contaminants, these foods get spoiled. So that is a different that makes a contaminant a contaminant. All right, so let's talk about biological hazard firstly. Biological hazard would be any microbial contamination that's happening when a food has been contaminated by microbes like bacteria, viruses, mold, fungi, and toxins. There are so many examples, like when the food is improperly prepared or at wrong temperatures, or if it's stored at wrong temperatures, if it's kept outside for longer durations. So those things, they allow the bacteria to grow, and that is called as a biological hazard, and the food has been contaminated. So there are multiple examples for that. First example is undercooking chicken can give rise to Campylobacter, which is a type of bacteria. During the rearing and slaughtering of animals, the salmonella that lives in animal intestines, it can transfer onto food products. And storing and preparing high-risk raw foods close to ready-to-eat food can lead to cross-contamination. For example, you have, let's say, Caesar salad or any salad with chicken pieces, and it's stored at incorrect temperatures, or if it's under, if it's not stored properly, so that can result in food contamination. All right. So this is a kind of danger zone for bacteria, and this temperature also shows around what temperatures it's safe to handle food, safe to control food, control contamination, and in what temperature zones the bacteria would grow, or where are the high chances that bacteria would grow. So as you can see, from 0 degree to 40 degree F, so at 0 degree, which is the freezer temperature, there are less chances of the bacterial growth. And then you go to 40 degree F, that's where the refrigerator temperature is. After that, 40 degree to 140 degree is the danger zone. There, the chances of the chances of bacteria being grown is, it gets exponentially increased in this 40 to 140 F range. And then there are different kinds of food that are still not very safe in this zone, and then you go below, like then you go beyond 140F is when it again starts getting like normal. So the contamination rates would be less. And then this is an acronym, FAT-TOM. These are the conditions that support the growth of microbial pathogens. So F is food. Now, food has all the nutritional components to support the growth of bacteria. So it has protein, carbohydrates, they're readily available. So the bacteria can grow really easily in food. Next is acidity. If the food is less acidic, it will enhance the growth of bacteria. So that's why there are like conditions that in less acidic conditions, the bacteria will not grow as compared to if the acidity of the food is little higher. Next is time. So pathogens need time to grow. And as you know, a single bacterium can multiply over millions and billions of times in 10 hours. Next is temperature. The pathogens, as I told, the danger zone is 40F to 140F. So pathogens can grow between 41F, which is almost 5 degrees Celsius, and 135F, which is 57 degrees Celsius. Next is oxygen. As we all know that there are some aerobic bacteria that can also grow in the presence of abundance of oxygen. And then you have moisture. Wherever there is moisture, there's humidity, there is good environment for bacteria to not just survive but thrive. So in our manufacturing fields, the time and temperature, out of these six, the time and temperature are the easiest to control. These two criteria can be controlled by us to make sure that our food is not getting contaminated. Okay, so we talked about different kinds of biological contaminants. How would we prevent them? So there are multiple areas where we can work upon, especially in a manufacturing facility. That's where I am coming from. So I would talk about those areas that we practice or the areas that are commonly used. So first is, of course, we need to clean and sanitize all our working areas, including unreachable places, because those places are the ones where we often neglect, and those areas have higher chances of get bacterial growth or any contaminant growth. So we need to be checking those areas as well. And the next one is we need to maintain walls and ceilings to make sure that there are no cracks or no holes. If there are, then it means that this facility is in contact with the outside environment. So that's again another area where bacteria can grow. Then next one is pest control checks in facilities and on food products. So this pest control checks, it needs to be happening very frequently to make sure that our facility or any food production environment is not getting contaminated by any pests or rodent droppings or cockroaches, or there are so many pests that can contaminate the food. So we really need to be making sure that we have our pest control checks in place. And next is regular audits. The audits are a really, really important part to making sure that our food manufacturing environment or our food production environment is safe to produce food. So those audits are a really important part in making sure that we are not having any sort of contamination. And the last one is practicing good manufacturing practices. Now, these GMPs, they have multiple areas to focus on, like appropriate PPE. PPE is personal protective equipment. So appropriate PPE, wearing hair nets so that our hair is not loose, uh, using gloves near the facilities and not touching the food with bare hands, and washing hands very frequently. So those are GMPs that we need to be in place. Next one is chemical hazards. Now, chemical hazards include detergents, pesticides, fertilizers, and even water. So how would we prevent these chemical contaminants? Chemical contamination or chemical hazards can be prevented by designating a suitable area which is away from production area to store chemicals. And those chemicals, they also need to be properly labeled with their expiry date or with their concentration, or if it's a hazard, if it's not safe for humans, then there need to be a proper hazard sticker. So those chemicals really need to be stored in a well labeled or well designated place. And we need to be rinsing our equipments or utensils that are getting used in food production, or equipments that are with direct indirect contact surface of the food. So those things need to be sufficiently washed with water after using cleaning agents to remove any residues. Now, this is a really big issue because there are equipments that we just wash it with our detergents, with our sanitizers, with our chemicals, and then the residues remain. These can end up in our final product, and that actually is a really, really great, really big issue, especially here in the US. So we really need to be making sure that we are rinsing off all the residue from our equipments and the utensils. And again, we need to make sure that our chemicals are correctly labeled, and then always check water supply and check the filtering system. We need to be making sure that the water supply at all times is good. Harmful chemicals or harmful other things are not really leaching into the water that is getting used in our manufacturing environment or food production environment. And then when the cleaning is taking place, or when sanitation is taking place, we need to be covering our food or our food contact surfaces to make sure that the chemicals don't end up on those surfaces. So, and the last one is physical hazards. So physical hazards would be any sort of objects that might get into food during preparation or serving. That might include equipment parts like balls, bearings, um, even metal shavings, damaged utensils, cleaning brushes, hair, nails, jewelry. So again, now these things, some of these things are also covered in our good manufacturing practices, where we need to be making sure, like let's say, your hair, it should be tied up, covered with the hairnet. You are supposed to be wearing a smock. You're not just supposed to go with your regular clothes near the production facility. So those are measures which are taking place to make sure that the food is not getting contaminated by all of these physical hazards. And how to prevent physical contaminants. So again, hair restraint using hairnet or suitable cap, long sleeves uniform, well-maintained equipment. We need to be checking our equipment after, like, every now and then, to make sure that the equipment is working fine. It's not having any metal on metal contact that is resulting in metal shavings, or our conduits, metal pieces. They all are in the place and they are not like lying freely on the equipment. No long nails, no jewelry near production floor, and well-maintained ceilings and walls. So these are all the ways where we can prevent the physical contamination. So now we've talked about all sorts of contamination, physical, chemical, biological. But the question is, I'm just telling you, like, oh, you can do this, you can prevent that, and that's how you'll prevent yourself from getting your food contaminated. But how does it really working? There has to be some standards, there has to be some rules and regulations in place that are followed all around the globe to make sure that our food is reaching safe, or the food from farm to fork is reaching safe without any contamination. So for that, we have HACCP, which is Hazard Analysis Critical Control Point. And I will get into that. But before I do, I would give you a basic idea of certain terms that we really need to understand in order to understand what HACCP is and how to implement HACCP. So HACCP, as I told, is Hazard Analysis Critical Control Point. What is critical control point? Critical control point is basically all the measures that eliminates likelihood of contamination and proliferation. And then there is another term that's called as OPRPs. It's operational prerequisite programs. So prerequisite is self-explanatory. It means it controls. So it's a prerequisite. It means it's not the actual measure that we are taking, that we are making sure, but it's a measure before anything happens. So it's like a preventative approach, and it controls likelihood of contamination and proliferation. And prerequisite program is are the standards, are the measures that ensures hygienic production environment. And this one on your right side of the screen is like a small figure that shows all of these three terms and how they are interlinked with each other. So on the first, you have HACCP and CCPs. In that section, the focus is on the raw materials, products, and processes. The next one is OPRPs, which are operational prerequisite programs. Their focus is on the prevention of hazard cross-contamination or proliferation risks during production. And the next one is PRPs, which are prerequisite programs. Their focus is on hygienic status of the production environment, which is facility, programs, and people. So if you understand this correctly, you would know that if we have failure of CCP or OPRP, that will result in high likelihood that product may contain a food safety hazard. And if we have a failure in our PRPs or prerequisite programs, now that may occur without immediate impact on product safety, because as I told, PRPs are not the actual standards that we are, not the actual measures that we are taking place. They are one step before the actual uh, event. So if we have a failure in PRPs, we still have some scope where we can improve and make sure that it does not get to the point where we have to put critical control points in place. So this is a small figure that shows all the how these three things are interrelated. And now let's get into HACCP. Uh, Hazard analysis critical control point. It's a self-contained system that allows a food manufacturing facility to eliminate risks of any potential hazards. Any potential hazards means all sorts of physical, chemical, or biological hazards. It also answers two key questions about safety of food that we produce or handle. What type of businesses I am involved in? What are the food safety hazards associated with my business? What causes those hazards? How can I control or remove these hazards? How can I show that I have controlled or removed these hazards? So these are just a part of your whole picture where you have like tons of questions before you get to establishing your HACCP. So these are just some of the questions that one might need to think about in order to make sure that whatever kind of food they're producing is good and safe to consume. Okay, so HACCP has 5 preliminary steps and 7 principles. So there are basically 12 points with 5 steps and 7 principles that make sure that we have an HACCP standard in place, or that makes a person or a facility HACCP certified. So the first preliminary step in HACCP standardization would be assemble the HACCP team and identify scope. Second would be describe the product. In the first, as you can see, the assembling, I would explain one by one all of these steps in my upcoming slides, but I'm just giving a basic idea of these steps on this particular slide. So assembling the HACCP team and identify scope would be working cross-functionally with all the teams in a manufacturing facility or in a food production environment. Now, this might include not just food safety department, it will include your operations, it will include electrical department, it will include engineering department, it will include logistics. So all of these people, all of these departments need to be working together with one another to make sure that our food is produced safe. And the next one would be describe the product. What exactly our product is, what exactly our product is getting manufactured. What is the method of that food production. How are we determining the shelf life? What is the shelf life of that? How are we packaging the food? What are that food product's physical or chemical characteristics? And any other relevant information to that's pertaining to that particular food product. The next one would be identifying the intended use and uses. So we have created an XYZ product. Whom this product is for? Who is getting benefit from this food product? Is there any age restriction to that food product? Um, is this food product specific to people, like are we catering this food product to diabetic people or any other condition that people might have? So we need to be identifying the intended use of this particular food product. The next principle would be construct a flow diagram. Now, in this flow diagram, we need to be covering all the steps in the processes which are directly under the control of the establishment. So our flow diagram should explain everything right from the point of where a raw material is coming from, how it's getting stored, how it's getting used, how it's getting to a production facility, what are we doing to that food, how our production is going to take place from the step where we are procuring raw materials up to how it's getting produced, to how it's getting stored and ultimately transported to the distribution centers or to the end consumers. So all of this flow diagram needs to be well established before we even start with the business. And next one, or the last preliminary step, would be on-site confirmation of flow diagram. It should not just exist on a paper, right? Like, this is the flow diagram, this is what I'm going to do. But in reality, the picture is completely different. What we claimed is not true. So the team, the auditing team, or the people who are responsible for this standardization need to be confirming the processing activities against the flow diagram that was provided during all the stages and hours of operation. Modify and document as needed. So these were the preliminary steps. Now, I've just explained one by one in brief about all the uh, steps. So first one, as I said, was assembling HACCP team. HACCP team would have production, shipping, quality assurance, which is food safety and quality, sales, maintenance, sanitation, even supply chain. So all these departments need to be working together to make an HACCP team. I'm sorry, one sec. Okay. Next one is describe product and processes. Now, I've given just an example of how one would describe the product, or the category description would be given. Here, there is just like an example for herbs, where there is the product category, the process, like how we are going to make the product usable, make this herbs usable for consumer. What are the food safety characteristics of this particular product? Who are the intended consumers, or which is the intended market for this product? Uh, Labeling. Now, labeling is a really, really important part of our food product. What will our label say? What's the product type, batch number, date of production, net weight, or if there are any allergens. If there are any allergens, we need to be declaring those allergens. Packaging, what kind of packaging we would be using for the product. What is the normal runtime of our product? Like, we are running product from, let's say, 8 a.m. to 12 p.m. How long is the sanitation cycle after 12 p.m.? So let's say our sanitation cycle is for 4 hours. So our run would be from 8 a.m. to 12 p.m. would be the first cycle. Then we have a 4-hour sanitation window. Then from 4 p.m. to 8 p.m. would be our next run cycle. So you need to be making sure that everything is clear and established in our describing of this product. And then shelf life and the storage and distribution. And the next preliminary step was identifying intended use. in which we identify who are going to consume our products. And in specific cases, there are, as I said, vulnerable groups, people with diabetes or any comorbidities or any conditions existing. So we need to be specifying whom are we targeting our product to. So there is an example of a frozen snack. So there is a ready to cook example, and uh, it's a very specific example, but it's just like what product we are giving. Let's say I'm giving a yogurt. I'm giving this yogurt to a senior care facility, and what kind of product would be okay for that particular group. So this is how we are identifying the intended use of our yogurt. Now, this is a process flow chart. It describes the processes, shows raw materials, processing steps, packaging, storage, and distribution stages. It will include information needed for hazard analysis, information on microorganisms that may be associated with the product, and what our process time is, what the temperature is, what are the clinical chemical usages, what are premises conditions, the hygienic design, cleaning. All of these things need to be uh, need to be provided to the T. So we need to be making sure that all things make some logic and all things have all elaborated steps, so that in case of any big contamination, let's say there is some listeria outbreak, so we need to be going back for our recall traceability. We need to be making sure that these were the processes that we provided, and those things need to be modified to make sure that such contamination or such events do not happen in the future. So on the right side, again, is an example. It's a process flow for freezing of herbs. So once we have given our process flow chart, next would be verifying if this flow chart exists and if it's 100% right. So we need to be checking the diagram. We need to be comparing the actual processes that are being carried out with the flow diagram. And then whatever discrepancies are there or whatever things that you feel are not right, then you need to go back, modify your flow diagram. So we discussed 5 basic elementary steps for HACCP. And now we'll be discussing our 7 principles of HACCP. I will be discussing these one by one. So number 1 is perform hazard analysis. Hazard analysis and detection of control measure complete 3 objectives. Number 1 is existing food hazards and associated control measures for them are identified. The analysis may find out necessary modification to the food processing or production so that product safety is more assured or improved. And when we are analyzing our hazard, it also gives us a clear picture in determining our critical control points that are in principle 2. So in hazard analysis, we would be basically analyzing, we would be, it's a working exercise for us to analyze what kind of hazards we might encounter. Because if we have uh, identified those hazards, it will be easier for us to establish our critical control points. So we are identifying the problem that need to be taken care of, right? So there is an example of how we do hazard assessment. If we For you guys, I will just give an example of, let's say, I would like to think, what are the chances that I might get salmonella in my facility or salmonella in my food production environment? Uh, what's the likelihood of that occurrence? Would it be improbable? Then I would rate it as 1. Unlikely. So we have like an index for all those events that one might think, like, what's the likelihood? How often do you think can this contamination event happen? If at all that happens, what is the consequence or severity of this disease? Would it be minor, medium, high, very high? Those are the different metrics that you would be rating. And after consequence or severity, then we would discuss what control measures are there. Do we have any control? Do we have medium control for such situations? Do we have high control for such situations? Or is there a benchmark? So we will use an example of such hazard assessment to analyze the hazards. And so we'll score this, and based on the score, we would decide what our risk assessment says and what kind of steps, what kind of critical control points we need to be taking place. So once we have assessed our hazards, next would be determining our critical control point. Now, what is critical control point? It's the particular point during the food manufacturing process where a hazard is likely to occur, which you can control with certain measurements. It is the particular point at which you can control or eliminate a hazard. Now, as the name suggests, critical control point is like a really important point that ensures in the scenarios, in the events where the contamination has happened. So these points would be how you would be preventing that contamination either in the future or in that particular event also, how we are preventing that, basically how we are making sure that now our food is safe. So those are the critical control points. The potential hazards that are likely to cause illness or injury, if they are not in control, must be taken into consideration during determining CCP. So this is an example of the decision tree that you would use in case of any contamination event. So if there is anything that has happened, let's say there is some metal contamination that happened, which means metal piece or metal slivers, metal flakes ended up on your food product, how you would determine what the critical control point are going to be. So there is a decision tree that you can refer. Is control measure available for this identified hazard? If no, then whether this control measure is necessary. If yes, is it a CCP, or if it's not a CCP? If it's not a CCP, then you need to stop. If it's not a control measure or the control measure is not necessary, then we need to make some tweaks, modify the process. And in cases if the control measure is available for the identified hazard, so now is this step or is our critical control point designed to eliminate the hazard? And then you just go, if it's no, then can this contamination with the identified hazard occur at this stage? So it's like a really long flowchart that you need to be using to determine what would our critical control point be. Next is establishing critical limits. Now, these limits are a quantifiable values that one uses uh, to which a physical, biological, or chemical hazard must be controlled. While critical control points separate safe food from unsafe food and also stop, eliminate, or reduce the hazard to an acceptable level. On the other hand, critical limits are usually numerical values based on scientific findings. Critical limits can also be of multiple types. First one is chemical critical limits, in which you can have critical limits for water activity, for pH, salt content, mycotoxin levels, absence of allergens. So these are all quantifiable values in which we can establish our limits. Like let's say pH. According to our food product, let's say about 3 to 4 pH is our critical limit. 3.5 is our critical limit. And we cannot be okay with manufacturing facility where the pH is above 4.5. So it means we have established our critical limit. and in that chemical critical limit. And the next one is physical critical limit, which is temperature, dried weight, time, absence of metal. These are all physical critical limits. Just like how we established our pH, in the same way we can establish a specific temperature. These all are based on scientific findings. Like, let's say, if I am in a milk facility. So according to that, I need to know what the temperature, what the ambient temperature for bacteria would be to grow in the milk. So I would avoid avoid the milk being stored in under this temperature in which the bacteria is growing. So I'm establishing a critical limit for the milk at all the times throughout the production facility. And then there are procedural critical limits also, in which we define what kind of procedures we should be establishing to make sure that none of the physical, chemical, or biological hazard end up contaminating our food. Next one is establishing a monitoring system. Through the monitoring, you need to measure and observe the CCP relative to critical limit. Monitoring is also essential to find out any loss of control and take corrective measures for it. So monitoring system is one step where we need to continuously monitor. You cannot just simply do monitoring once in a day or once every week. It needs to be continuously monitored. The food production where it's happening, it needs to be continuously monitored to make sure that all the steps, all the measures are taking place. And if there is any loss of control, we are getting right into the action and we are taking corrective measures for it. And wherever possible, we need to be making process adjustments when monitoring results, if they're indicating a trend towards loss of control at CCP. So adjustments should be taken before the deviation occurs. Next is establish corrective actions. So let's say some contamination event has happened. So now we need to make sure that we have established corrective actions to make sure that it does not happen in the future. And it also holds us accountable, uh, so that if there was some mistake or some issue at facility end, then we need to be making sure that because of these corrective actions, now we would not be doing so in the future. So as we know, hazards can happen willingly or unwillingly. Deviations in food processing can happen with proper measures taken and even after establishing control. Corrective actions are measures taken in case any deviation occurs, and corrective actions are a set of planned actions that should be carried out by nominated persons. Now, these nominated persons are designated certified authorized personnel. Only these people can establish these corrective actions. Not everyone in a food production environment is allowed to do so. There are two kinds of corrective actions. Firstly, corrective actions you should take to prevent loss of control at our established critical control point. And secondly, corrective actions are to be taken when loss of control at a CCP has been identified. So there are steps that are involved in implementing corrective action. Uh, Firstly, we'll start with the problem. We need to identify the problem. Once we have identified, like, okay, we got salmonella in our food. That's our problem. We would have to investigate the cause. After doing all our root cause analysis, we established that this salmonella came from an open drain. So the water backed out from that open drain and it might have contaminated our food contact surface or the equipment nearby. That's where the salmonella happened. So that's her cause. Now we need to develop an action plan. This action plan would be, we need to be enhancing our sanitation plan. We need to be making sure that whatever sanitation we are doing is eliminating the salmonella. And this drain where this salmonella originated, that drain needs to be taken care of. That drain needs to be either washed multiple times, or washed with a different concentration of chemical. So that's an action plan. And then for that, we need to assign responsibility. We cannot just make promises in the air that we would be doing this, we would be doing sanitation. We need to be making people accountable. We need to assign responsibility to specific personnel who will be taking care of the steps. And then we need to be implementing the plan. Once the plan is implemented, then you go back, you verify that this plan has taken place. And that's how you establish a corrective action. Next principle is establish verification procedures. This principle confirms that the HACCP plan will produce safe food for the final consumer if it is followed properly. The process of verification has three main components, which are validation, verification, and review. So again, there is an example in which there is a control measure where product temperature every 30 minutes between 50 to minus 18 degree. Now, this is a control measure for a product, herbs, as for example, herbs. So what is our corrective action? If we are seeing that there is a temperature deviation in this frozen product, so what is our corrective action? We need to be keeping the product under hold, and then the product needs to be immediately refreezed. After refreezing the product for a certain amount of time, we need to be checking the temperature again. And not just the temperature, first we need to make sure that our standard or our thermometer against which we are checking, that needs to be calibrated. This is also a corrective action. Now, we need to be recording our temperatures, what actual problem was, what actual temperature was this product found at. After we held this product for 24 hours or 48 hours, what's the next temperature that was found at? If the product is found to be at good temperature after putting the product on hold, then it is good to release. So that needs to be documented. That needs to be verified and documented. So this is how you establish your verification procedure. And next one is establish record keeping and documentation. So principle 6th and principle 7th, they go hand in hand. Once you do verification, you need to be making sure that everything is documented and we have the records for all our corrective actions, for all the principles that we just discussed. The last step and HACCP principle is to keep a record of each and every step of the HACCP program. Firstly, it acts as the proof that your food business runs by taking all the necessary food safety measures. Secondly, the documentation acts as a guideline so that everyone in the business can stay informed about the HACCP program and what to do to ensure food safety at any point. So now we discussed HACCP, but this HACCP is a part of our even bigger set of standards. That's ISO 22000 version 2018. Now this is a bigger picture under which HACCP is just a part of the standards. ISO 22000 version 2018 is specific to food safety management systems, and it's also important to know about this since this is a standard that is usually followed all around the world. So ISO 22000 is an internationally recognized standard that specifies the requirements for a food safety management system. It integrates the principles of hazard analysis and critical control points, which are essential for ensuring the safety of food at every stage of production. And as I told, it's a combination of HACCP, RPs, PRPs are prerequisite programs, and FSSC 22000. This is again food safety certification that comes under ISO 22000. And by adopting ISO 22000, Organizations demonstrate their commitment to the safety, quality, traceability of their food products, which ultimately helps in building consumer trust. Now, these are components of ISO 22000. Number one is management commitment. Then there's food safety policy and objectives that basically helps in establishing food safety goals and ensuring that they align with the business objectives. Third one is the one that we discussed, hazard analysis and critical control points. They identify food safety hazards and implement control measures to mitigate the risks. Next one is operational control. It ensures that the food safety practices are implemented at every stage of production. And the next one is verification and validation, which means that we are regularly monitoring and evaluating the effectiveness of our food safety controls. So, by validation, you would say that it's if we are monitoring something and if we're monitoring it multiple times throughout our throughout our production, we are validating our results. We are validating our food safety controls. And the last one is continual improvement. Continual improvement is an ongoing process. Like we need to be making sure at all times that the food safety management systems are working perfectly fine. They're based on and they're based on monitoring and audit results. So these six are the basic components of ISO 22000. And ISO is international standard organization. And these are the benefits of ISO 22000 certification. So if a food facility says that they are ISO certified, they have numerous benefits. First one is it cuts investigation time to a minimum. So the management system, it helps you to reduce food safety breach investigation time. Customer satisfaction. Of course, if somebody's saying that their facility or their business is ISO certified, the customers tend to have more trust. They will be buying more products from that facility. Since this is an intensive certification, it requires multiple sets of rules and standards that you need to be making sure that your company is adhering to. So it is a really great certification, and this customers will develop better trust. And ISO is a globally recognized certification. It's recognized internationally, accepted throughout industry supply chains, setting industry benchmarks for sourcing suppliers. Uh, Proven business credentials. It's an independent verification against a globally recognized industry standard, so it speaks volume of the quality that it's providing. And legal compliance, it understands how statutory and regulatory requirements impact your organization and its customers. And ability to win more businesses, of course, if it's certified. So the procurement specifications often require certifications as a condition to supply. So certifications open doors. Since it's, again, very stringent regulations. So if a facility is ISO certified, it means they're following those stringent regulations, and they're more committed towards food safety. Respond to situations. So they're ideal for responding to situations that can compromise the food safety of both products and production processes. And these are the key changes that have been made from what the older version was, which was in 2015, and now the latest one is 2018. So these are the key changes that are made to this certification. It is more structured, more organized. This new version follows the same structure as all other ISO management system standards. It's a risk-based approach now, so the new standard will now include a different approach to understanding risk. Basically, it involves more, now more focuses towards our HACCP systems, especially on our critical control points, as compared to how it used to follow the 2015 standards, which did not follow HACCP that much. And this Plan to Check Act cycle is the latest addition that they've made in ISO 22000. This standard clarifies the PDCA cycle by having two separate cycles in the standards working together, one covering the management system and the other covering the principles of HACCP. So it means it combines our operations, the management system with the HACCP. So it's like a more holistic approach towards getting yourself standardized. And the last one is operation processes. So there is a clearer description. It's given to highlight the difference between key terms such as critical control points, CCPs, operational prerequisite programs, which are OPRPs, and prerequisite programs, PRPs. These three terms I uh, talked about before I started talking about HACCP. So these three terms, they are also more defined in the new 2018 version. And that is all from my side. I really hope that you understood, you have a better clarity on HACCP, and if you have any questions, you can ask away.
Thank you, Kaveri. Thank you very much for your very wonderful, insightful lecture. And any students, faculty, if you have any questions, please come forward and ask the questions. Any students? So this lecture is very helpful for all the students who have studied food safety or who are studying food safety or who will study food safety. And how you are integrating AI, machine learning, etc. Kaveri, are you doing anything like that in food safety?
Currently, we are not really integrating AI systems, but in one sense, AI system, I would say we are now like looking forward to is in our establishing critical control points more. So like if our manufacturing, if the process of the manufacturing is understood in a better level, AI would help in establishing what the critical control points are that we might be missing out on. And not just that, even with supply chain or logistics, AI would be really helpful in establishing the supply chain issues. So that's where we are thinking right now, but currently we are not using.
Okay. Any questions from students? Any students? If you have questions? Okay. So formally, I take this opportunity to thank Ms. Kaveri Dang, who is our alumni from first batch of BSc Honors Microbiology. I still remember in 2015, our first batch joined, and I am very happy to see their progress. Thank you, Kaveri. Be in touch. And I would like all the students to take help through her in the social media, LinkedIn. She is very much there. And if you have any queries, you can approach her and make your career. So thank you once again, Kaveri. Thank you once again for sparing
Thank
your
you so
time.
much.
Thank you.
Yeah.
Thank you.
Okay. All right.
Thank you. Students, this session is over. Thank you very much. Thank you, all students and faculty.